Hello everyone, welcome back to our channel. This is Guntur Medical College Department of Anatomy. In this dissection video, we will see the blood supply of the heart. So we have completed the chambers of the heart. Now we will start with the blood supply of the heart. First we will start with the arterial supply. Arterial supply of the heart, we have two coronary arteries. This is the right coronary artery and this is the left coronary artery. So we have two coronary arteries arising from the aortic sinus. So this is the right coronary artery arising from the anterior aortic sinus. If you see the course of this, taking origin from this aortic sinus, but we have not dissected aortic sinus. It appears in between the pulmonary trunk. Yes, this is the pulmonary trunk. It appears in between the pulmonary trunk and the right auricle. So this is the pulmonary trunk and right auricle. It appears in between this pulmonary trunk and right auricle, then runs in this right anterior part of the coronary sulcus. So this is the anterior part of the coronary sulcus. Coronary sulcus is atrioventricular. So this is right atrium and this is right ventricle. So this is the anterior part of the coronary sulcus. It runs in this anterior part of the coronary sulcus, winds around the inferior border of the heart. Can you see? This is the inferior border of the heart. Winds around the inferior border of the heart, then runs in the posterior part of the coronary sulcus so that it will anastomose with the left circumflex artery. So that is the course of the right coronary artery. So we can, for descriptive purposes, we can take this from this origin up to this inferior border as the first segment, then in the posterior part of the AV groove as the second segment, to understand the branches. So first we will see this first segment branches. It supplies right ventricle and right atria. So if you see the right ventricular branch, first branch to this infundibulum, this is the infundibulum. So first branch to this part will be called as the right conus artery. So this right conus artery, if it arises from the aortic sinus, that is called as the third coronary artery. So and again it gives so many branches to this, supply this sternocostal surface of the right ventricle. If you see the atrial branches, it supplies the right atrium, and one of this branch, if you dissect further, it will supply the SA node. If you see the ventricular branches, one branch runs along the inferior border of the heart. So this running along the inferior border of the heart, it will be called as the right marginal artery. If you see this running in this posterior part of the coronary sulcus, it anastomoses with the left circumflex artery near the crux of the heart. What is crux of the heart? The student should know. It is the junction of atrioventricular sulcus, posterior interventricular sulcus and interatrial sulcus. So this point is called the crux of the heart. So slightly to the left of the crux of the heart, it anastomoses with the left circumflex artery. When it comes in this part of this posterior part of the AV sulcus, it gives the branch posterior interventricular artery. You can see this is the posterior interventricular artery which runs in the posterior interventricular sulcus. So according to this posterior interventricular origin from right or left, it is called as the coronary predominance. If it arises from the right, it is called as right predominance. This segment supplies this part of the right ventricle also and the posterior part of the ventricles and the atria. So this is in brief about the right coronary artery. Detailed description of the blood supply of the heart. We have one more video in our channel. You try to watch that. This video is mainly to help you to understand the course in the dissection. So again, now we will start with the left coronary artery. Left coronary artery arises from the left posterior aortic sinus. So that is the origin. You can see. It is interesting to see it passes. The major vessel is passing behind the pulmonary trunk. This part may be compressed in sudden exercises in heavy athletes, leading to the sudden cardiac death. Sometimes this may be running in between pulmonary trunk and ascending aorta. That is the cause of sudden death in the athletes. So this part running behind the pulmonary trunk, then it appears between the pulmonary trunk and the left auricle, It divides into two branches. This is the anterior interventricular branch and another is this left circumflex branch. So this is the anterior interventricular branch. It is the continuation of left coronary artery. Large terminal branch runs in the anterior interventricular group. It supplies mainly the left ventricle and the strip of this right ventricle along the anterior interventricular group. It also gives the left conus artery. Sometimes it gives this appears one large artery from the anterior interventricular that will be called as the left marginal artery. So this is the left marginal artery. It should reach the left border of the heart. This right marginal artery is not running on the right border, it is running on the inferior border. So that is the supply of this anterior interventricular. This anterior interventricular branch anastomoses with posterior interventricular branch in the posterior interventricular group. This circumflex artery we will see now. This left circumflex artery runs in the left part of the AV groove, then it reaches this posterior part of the coronary sulcus where it anastomoses with the, you can see it has anastomosed right and left near the crux of the heart. So what is this left circumflex branches? It may supply the AV node, it may give the AV nodal branch, and this, if you see, anterior interventricular branch supplies the interventricular septum also. This left ventricular circumflex may give the posterior interventricular artery. As we already told, according to this posterior interventricular artery, whether it is right or left, it is called as the right coronary predominance or the left coronary predominance. So that is about the two arteries, main two arteries we have seen, right and left coronary artery. In this, if you see in this coronary sulcus, along with the coronary arteries, the vein which we are seeing here is this coronary sinus. Along with this posterior interventricular artery, are you seeing this is the middle cardiac vein. If you see along with the anterior interventricular artery, what is that vein? If you are seeing, that is the great cardiac vein. So all these are the major veins of the heart. Coronary sinus, which contributes to the 60% of the venous drainage of the heart, it opens into the, we have seen in the interior of right atrium, it opens into the smooth part of the right atrium. So that is the opening of coronary sinus, which we have seen in the previous video. So that is about the major veins of the heart: great cardiac vein, middle cardiac vein and the coronary sinus. I hope you should have understood the dissection part of the blood supply of the heart in this video. For the detailed description of the blood supply of the heart, you see we have two videos in our channel, blood supply of heart 1 and 2. That is a very elaborate video of the blood supply of the heart. Thank you.